This is your CT Style Express, and I'm Teresa Dufour. If you or someone in your family needs a COVID-19 test, Doc's Medical Group offers rapid testing with no referral at all of their locations. CEO of Doc's Medical Group, Dr. J.D. Sedana, joins us via Zoom. Doctor, thank you for chatting with us today.
Hi, Teresa. Thanks for having me.
So first off, let's have an overview of Doc's Medical Group. I know you have locations all over the state.
Yep. So Doc's Medical Group was founded as an urgent care clinic. Our first clinic was in 2009 in Orange, Connecticut. We currently have 18 clinics throughout the state of Connecticut, and we've expanded from offering just urgent care services, which we still do, which is a majority of our book of business. But we offer primary care services. We have primary care physician in all locations. Pulmonary medicine, cardiology, allergy, sleep medicine services, to name a few. That's most of what Doc's Medical Group does currently.
And we were just chatting before, you guys have x-rays on site and a lot of a lab on site.
Absolutely. So all of our locations, have on-site testing services. So there's a lot of things, lab tests, for example, which there's availability of these devices that you can actually run a test over 5 to 10 minutes in the office itself. It saves people a lot of time rather than waiting for a test result 2 to 3 days later, getting a call back. And a lot of those tests are also critical in terms of assessing a patient's need to be going to a hospital, to not go to a hospital. So it helps us as physicians take better care of our patients as well. And there are x-rays in site. So if there's somebody who has an injury or there's somebody who needs an x-ray, whether it's for pneumonia, bronchitis, things like that, we're able to offer those services right on site as well.
That's fantastic. And doctor, how is the COVID-19 testing happening?
So the COVID-19 testing, currently what we are doing is a rapid nasal swab. We are using an instrument made by a company called Quidel. This is something which has been FDA EUA authorized. The test takes 20 minutes. The current data on the test is that the test has a sensitivity of 96% and a specificity of 99.5%. So what that tells us is that this test is pretty accurate, and it compares very well in terms of when we look at it in comparison to tests which are being done as send-outs and being sent to various different labs.
And this is a quick response for people.
This is an awesome test because when COVID initially happened, Doc's Medical Group was doing swab and send-outs, and in March and April there was a shortage of actual swabs itself, and the swab and send-out was taking anywhere from 24 to 48 to 72 hours for patients to get their test results. Unfortunately, because of the surge that we're experiencing in different parts of the country, this time period for most labs has now gone up to 7 to 10 days. Which to me, honestly, as a physician is quite unacceptable, because if somebody is concerned about having COVID, or if somebody has traveled and they need to quarantine themselves or they need to isolate themselves, not knowing what your test result is for 7 to 10 days completely defeats the purpose of having the test oftentimes in the first place.
Sure.
So having a test which can actually give you a result in 20 minutes is a game changer when it comes to COVID testing right now.
Yeah, and not to mention the anxiety of waiting and everything else that goes along with that. So that's so important. And doctor, I know you have the antibody test as well, not just the rapid results.
Yeah, no, absolutely. So we also have the antibody test, and the antibody test is a blood draw. That is a send out currently, and the turnaround time for that test result to come back is 2 to 3 days. The antibody test currently does not have any clear guidance from the CDC or the FDA in terms of how to utilize it. However, in our opinion, when we are recommending this to patients, we are actually saying use the antibody test if you feel you had an infection, because the nasal swab test is only going to be positive if there's an active infection, meaning somebody has been infected over the course of the last 2 to 3 weeks. Anybody who feels that they had this infection in March, April, May, or June, those are people who we recommend for them to have an antibody test, because that'll tell them if they had a prior infection. And anybody who is dealing with a lot of people, somebody who works in a public place, somebody who works in a restaurant, somebody who works, in a doctor's office or something, or a grocery handler in a store. If you know what your antibody status is, I think it puts your mind at ease in terms of knowing, okay, I've already had it, or I'm at risk. I need to continue to take the adequate precautions.
Right.
Everybody should be taking precautions. However, knowing what your antibody status is goes a long way in easing our minds in terms of how we respond or react in certain situations.
Sure. And doctor, I know you don't need a referral, but you probably should register online ahead of time.
Absolutely. So people should register online ahead of time. So our online registration system is essentially which allows all the data to flow into our electronic health record system. What we are encouraging people to also do is they may register online, but they have to also physically come to the spot in time. And, we have a line system which we use through one of our apps, and that will actually maintain and manage the lines on site itself.
Sure.
Unfortunately, because of the fact that there is a higher demand over the course of the last 2 to 3 weeks, we are seeing an increase in the number of people who are trying to seek our services. And there's not too many other places right now which offer the rapid test. So given that circumstance, what we're trying to do is trying to manage the best we can in terms of line management so people don't have excessive wait times.
Sure. Well, everyone has to have a little bit of patience during a pandemic, right?
Absolutely. And listen, it's new for us, like it's new for everybody else, on the planet, and like it's new for everybody who's coming in to get tested. This is new for medical offices too, and how our office operates today is very different from how our office operated even at the end of February of this year.
Sure, makes sense. And of course, you could learn more over at docsmedicalgroup.com. Dr. Sidana, thank you so much for all the information and for what you're doing.
Absolutely. Thank you so much. Thanks for having me.